All right, thank you everyone for coming today to my speech. I think it's really timely right now given our conditions outside. It's cold, it's icy, it's slick, no snow in the forecast at all. And we've got a bunch of poor skiers coming in from out of town that are going way too fast, and they're tripping and they're falling. And imagine they fall down, you get on scene, they're knocked out, maybe they're unconscious, maybe they're semi-conscious, maybe they don't know where they are, they don't know what happened to them, their helmet's cracked open, they're agitated and confused. What can we possibly do for them? What we're looking at as we arrive on scene and we don't find any blood, their airway's okay, but you're just seeing this person that's in and out of consciousness. So what we're trying to fix is an invisible injury, and that invisible injury is a traumatic brain injury. So something I want to stress to you guys all is that supplemental O2 on scene of a traumatic brain injury is very beneficial to our patients. In this speech, I'm going to tell you guys what interventions that we can do for a traumatic brain injury, why supplemental oxygen is so important, and how we can also avoid hyperoxygenation of our patient. With that being said, first and foremost, I want to stress that damage can occur in the brain within 4 minutes of impact. And the best way to mitigate long-term damage to the brain is by providing supplemental oxygen. So once you arrive on scene and we notice our signs and symptoms of TBI, which can include loss of consciousness, agitation, confusion, not knowing where you are, who you are, what happened, etc. As soon as we recognize that and we notice that our patient does have an airway and we don't notice any major bleeds or anything, we should instantly be calling for supplemental oxygen and applying that to our patient within the first 4 minutes to mitigate any long-term damage to the brain. Secondly, the increase in oxygen that we're supplying via nasal cannula increases cellular metabolism in the brain. Oxygen is one of the ingredients that an injured brain needs to help assist in the healing of the damaged tissue. It can also decrease swelling and decrease mortality rate in the hospital by up to 50%. And also it helps stabilize the vitals. So by providing supplemental oxygen, you're stabilizing the blood pressure, you're stabilizing pulse rate and respiratory rate. And by having those 3 stable vital signs in the field, once they're loaded into the ambulance and in the hospital, once again, mortality rate can decrease by 50%. Last but not least, it's important to recognize that it is possible to over-oxygenate our patients. So something to avoid if you have a conscious and alert patient is avoid putting a non-rebreather at high flow. So putting a non-rebreather at 15 liters per minute is probably too much oxygen for a person with an injured brain. Once you have such a high rate of oxygen being forced into a patient, it actually can serve as a vasoconstrictor in the vessels in the brain, which is having the opposite effect, and the brain's then not getting the oxygen that it needs, even though we're supplying too much oxygen. So avoid avoid non-rebreather at high flows, but instead nasal cannula at low flows is going to be the most beneficial thing for our patients with traumatic brain injury. So in conclusion, I just want to stress to everyone that once we identify the signs and symptoms of a traumatic brain injury on Bald Mountain, the best thing that we can do is to get oxygen on scene as soon as possible, as long as your patient has an airway and is breathing. Go ahead and put the nasal cannula on between 2 and 6 liters per minute and avoid over-oxygenating your patient. And low flow oxygen nasal cannula is going to increase cellular metabolism, decrease swelling of the brain, and help stabilize your patient's vital signs. And with that, once we're on scene of an unconscious or semi-conscious patient and you're not entirely sure what to do with that patient's invisible injury, the best thing that we can possibly do is to give timely administration of supplemental oxygen for a traumatic brain injury, because that can quite literally be the difference between life and death in a traumatic brain injury patient. Thank you.